Hi, my name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in sports medicine. Today, I'd like to talk to you about management of rotator cuff tears with the bioinductive implant. Historically, rotator cuff tears were initially managed conservatively and then surgically if warranted, and there's nothing wrong with that. However, over the years, orthopedic surgeons have attempted to develop ways to increase healing rates of rotator cuff repairs. So while patients still did well if surgical intervention was warranted, our healing rates of rotator cuff of repairs was not always ideal. We initially thought it was biomechanical, and so stronger sutures and stronger anchors were developed. However, this did not help rotator cuff healing rates. Over the last few years, there's been an increased attention focused on the biology. And in the biology of healing the rotator cuff tear, we realized that promoting improved biology led to improved healing rates of the rotator cuff repairs and subsequently happier and better patients. The Regeneten Bioinductive Implant is the leader in the biological augmentation of rotator cuff repairs. The bioinductive implant is a bovine-based collagen implant that allows for promotion of better collagen formation at the site of a rotator cuff injury. In fact, the bioinductive implant itself can be used alone for partial tears without the need for any suture or anchor augmentation. This allows for earlier mobilization of the patient in a sling use for only 1 to 2 weeks, followed by full recovery, oftentimes in 6 to 12 weeks. This is dramatically different from a patient who might be in a sling for 6 weeks and including 6 and 8 months of physical therapy. Furthermore, this Regeneten or bioinductive implant has been able to augment traditional rotator cuff repair. So if a patient has a large, or what we call a massive rotator cuff repair, or has had previously 1 or 2 prior repairs and have failed, we can repair the rotator cuff with traditional suture and anchor techniques and then apply the Regeneten Bioinductive Implant over the repair to increase and improve healing rates. The research has shown that this has tremendously helped, and in fact, multiple other developers and industries are attempting to mimic what the Regeneten Bioinductive Implant can do. That's why I'm a big believer in this implant and utilizing it for my patients when necessary. I think that promoting optimal outcomes in patients, we need to continue to look and explore at different implants and techniques to improve our patient outcomes. If you'd like to hear more about the Regeneten Bioinductive Implant, please come in and we can discuss it for your potential shoulder injury. Thank you.